Today it is my pleasure to welcome Dr. Doctor Bedi. He is the Director and Head of Orthopedics Department at Vasant, Kunj, New Delhi. Hello.
Hello.
How are you?
Very good, Sharmila, and good to talk to you.
It is my pleasure to connect with you once again. I'm so fortunate that you have taken out time for me.
Thank you so much. Thank you so much.
Dr. Bedi, there is a problem these days which one sees with every young fellow. They are always engrossed on their mobile phones, whether they are on the two-wheeler, whether they are working on the computer, whether they are eating, whether they are watching TV. The use of mobile phones is always there.
Yes.
So have you come across youngsters coming to you with problems related to excessive use of mobile phones?
Yes, Sharmila. In fact, it seems to be a ever-expanding problem if you have a look at it. Initially we were thinking that orthopedics is much more the elderly population which will come, the above 60s having joint pains and everything. But a lot of people that we are now seeing is a much younger age group, and a lot of it is that got to do with their work environment. So a lot of people, I think we know, have shifted to using laptops almost like all throughout the day, or phones, and a lot of everything that we do, whether it's a messaging or sending or connecting with other people, has got onto the digital medium, which is very well known and which is very well expected, seeing how catchy it is. A lot of people hence are having a body posture which is not really akin to what you would call as a normal alignment and normal posture of the body. So whenever we stress the body in a way that it was never designed to, such as leaning forward almost the whole day, having your shoulders and neck peering down into small screens, trying to write and type with the finger again and again, all these are actually causing a new set of problems, which is almost you can almost cause an exclusive problem for these youngsters. And we see actually a lot of these people now coming back to the clinic with these issues.
Okay. So what kind of sort of prevention methods or what kind of treatments do you suggest?
So I think one thing that we tell a lot of them, obviously we would like them to restrict their viewing time for this, which is not always possible.
It is not
because
possible.
I think
they will not listen.
I totally agree with you on that.
Yeah.
So I think, one is, shifting to a bigger screen maybe is a very good idea.
Okay.
At least you don't have to peer down on it.
Okay.
And the other thing is, I think, bringing things up to your eyes rather than bringing your head and eyes onto the machine is a better idea.
Okay.
So keeping your shoulders sort of braced backwards as much as you can, getting your head almost positioned on top of the shoulder, and trying to keep things here rather than peering down like this is a good idea.
Can you show to the viewers?
Sure.
Young fellows, please see what the doctor says. How should be your posture when you're using your mobile phones? Actually, you should cut down on the use of mobile phones, but if you can't, at least follow the postures which he suggests.
Okay. So I think one thing is bracing your shoulders backwards. It's almost like getting your shoulder blades to be kissing each other. It looks slightly unusual when you look at it, but if you just get your shoulders to go as square as you can rather than this droopy thing, it makes a huge difference to these muscles between the shoulder blades and the neck muscles, because they're much more relaxed. With this, they're all stretched out. With this, they are much more relaxed. In fact, even when you get a chance, squeezing the shoulder blades together is a good exercise. So if you got your phone in your hand, it's much better to be sort of looking at it this way, almost sort of square on with the eye rather than this. So, looking at it this way, typing it out with your fingers and all, possibly would be a better way to approach things. And remember, make your screen bright and make the words as large as you can, because the more your screen is darker, more you are trying to peer down into it, which is going to be a big problem. Ear on top of the shoulder, shoulders braced backwards, keeping your back straight. And frankly, if you can actually exercise regularly, at least sometime in something like a yoga or something like that, to get your alignment better and keep stretching your muscles, you're much better prepared to avoid these problems for the future.
And what kind of problems? Just tell them that you may have these serious issues.
Sure. So the one thing that is very, very common is the pain element, which I said. So the pain now, is hardly ever at the top of the neck. Everybody is saying the cervical ho gaya. It's not the cervical ho gaya. You've actually sort of, almost like "Aa bail mujhe maar" wali kahani, because you're just asking for trouble with this. So the pain people are talking about, what is the base of the neck? From the base of the neck, it travels down in between your shoulder blades. You start to get very fatigued, very tired. The pain is normally a dullish kind of a pain. Normally it's, you keep doing this kind of shoulder movements trying to, relieve the pain. Your sleep occasionally starts to get disturbed because of the discomfort that you're getting. You keep getting fidgety and you're sitting up, standing up all the time. As an extreme case, you can even have, because of the pressure on the disc, you can have some nerves getting pinched, causing that amount of tingling and something to come into the hands. But majority is that dullish pain which is there, and sometimes actually comes down almost onto the arms, and that's what people would come to us with.
यंगस्टर्स, अगर आप सुन रहे हैं डॉक्टर बेदी को, तो प्लीज़ फॉर गॉड सेक थोड़ा सा ध्यान रखिए. डू नॉट यूज़ मोबाइल फोन्स सो मच, एंड इफ़ यू आर यूजिंग, एटलीस्ट डू रिमेंबर टू फॉलो सर्टन postures which will help you. और एक और हमने बात देखी है, which is, my God, it is really scary. They are on the two-wheeler. Inside the helmet, they tuck the mobile phone and they're talking on it while driving the scooter.
Quite right, Sharmila. I don't know why this infatuation of having to respond immediately to every call.
Yes.
It just, you're putting so many things at risk. It's okay if you don't care about your own life, but at least avoid putting other people's life at risk. Some poor man will get injured because of these accidents. You will end up having an accident someday or the other, and you will end up blaming other people for the fact. But also, this kind of a position is such an awkward position. It just belies expectation that, or any belief that anybody would keep actually talking like that and then driving and then expecting, I don't know why I get this pain. Then they start blaming things like, मेरा पिलो खराब हो गया है, मेरा बेड खराब हो गया है. It's so obvious. I would leave my neck like this for 5 minutes and I'm sort of dying to get rid of this. And people carry on driving motorcycles with this position. It just is unbelievable.
Ridiculous. So thank you so much. I think he's given some very, very useful tips, and I hope you have learned little bit some guidelines from this session. So please take your life seriously, and wherever you are, on the road or in your drawing room or in your bedroom, please reduce the working hours on the phone. It is not the end of the world if you reduce it 5 minutes every day. Thank you for viewing this. Thank you so much,
Sharmila. Thank you.
It was wonderful.